Every year, billions of dollars are spent on medical research. The National Institute of Health alone invests around $30 billion in research here in the U.S. All that investment means medical breakthroughs are happening more than you might realize. I'm Christine Pae. Each week I produce Healthlink, a segment for King 5 that highlights some of the biggest health news that you need to know about. Today we're sharing some medical breakthroughs, including a new treatment for Alzheimer's patients at Harborview, a groundbreaking nerve transplant surgery, and using stem cells to regenerate tooth enamel.
I had a long history of cholesteatoma, which is the infection in my ear.
Kim Rossman, a mother of 3 and a longtime pharmacist based in the Seattle area, says those ear infections began to affect a nerve.
And then when the nerve finally was on its last nerve, I was at home and I noticed that my face just sagged. And immediately I thought, oh my gosh, I have a stroke.
The entire left side of her face was frozen, but her doctor said it wasn't a stroke.
And she did an evaluation. She said, no, you don't have a stroke. It's that last nerve that finally just snapped. It was no longer viable.
Close your eyes gently. Relax.
For weeks, Rossman and her doctors monitored her symptoms.
Give me a small smile. Relax.
I slowly could not move my eyebrow. And then I could not, I brushed my teeth, and then all of a sudden, I was rinsing, and all the water was dribbling out of my side of my mouth. So I couldn't figure out what was going on.
Rossman searched everywhere for answers and eventually got connected with a surgeon at Providence in Everett.
This patient had facial paralysis, which can happen due to any number of things, and in her case, it was a cyst in her ear that damaged her facial nerve.
Dr. Prabha Bama is a facial plastic and reconstructive surgeon and heads the Providence Center for Facial Paralysis.
So facial paralysis can be caused by stroke. It can be caused by trauma, like a fracture of your ear bone. It can be caused by a laceration, like a cut. It can be caused by gunshots. So any sort of trauma can cause facial paralysis.
Rossman's case was more rare and unexpected.
This had been going on for years and years before, but this is kind of like sudden, and it was hard to accept that.
But Rossman had hope. Dr. Bama performed a nerve transplant using the chewing nerve in her jaw.
And we transferred that nerve to the end branches of the facial nerve, and that over a few months provided nerve input into the muscles of facial expression.
The results were striking. Months after recovering, Rossman was even more hopeful during a checkup with Dr. Bama.
Sure enough, right at the 6-month mark, he said, smile, and I went, he goes, oh my gosh, and I just cried. Knowing I could smile again.
Rossman says she will never take smiling for granted.
So I told my family if I could smile again, I'll do it more often. To strangers, to whatever, you know what? We're all beautiful inside. And whatever we project, hug, kiss, it doesn't have to be just a smile, it can be just a gesture.
Sickle cell patients often rely on bone marrow donors to help manage their disease. Well, now a new type of treatment that uses gene editing technology known as CRISPR is being described as a game changer.
It was like one of those moments where like you're running, like almost like a marathon runner, and then you make it to one of those checkpoints that matter.
Katie Hall has been on that marathon since her daughter, KJ, inherited the genetic condition known as sickle cell anemia, which commonly affects Black patients. For years, King 5 has been following their journey with sickle cell and the advocacy work they do through Hall's foundation, now on its 10th year. With the new therapy approved by the FDA in December, Katie and KJ can now dream of a future without pain.
It means the difference of, in the wintertime, being able to go skiing and not thinking about, okay, we got to put on all these extra layers. It's the difference of going swimming in Washington State. It's never really hot here. That's why we bought a house down in Florida, so that she could swim. You know what I mean? It makes the difference of so many things when you think about not having to worry about chronic pain.
All possible now with a new treatment that uses CRISPR gene editing.
They work essentially as a transplant.
Dr. Kleber Fertrin is a hematologist at Fred Hutch Cancer Center. He calls the now approved gene therapy for sickle cell disease a game changer.
Because it allows virtually any patient to have a donor because they don't need a match. They can get this treatment using their own stem cells.
and reduces the reliance on a donor match that can be difficult to find. Fertrin explains the treatment modifies sickle-shaped blood cells to maintain their normal round shape.
So you would get their stem cells, you modify them genetically to fix the disease in a way, in different ways, and then you perform a transplant of their own cells, but now modified so you can improve the disease.
Instead, he calls the treatment transformative.
Because in clinical practice, the way patients feel after this treatment, they will feel functionally better. They won't have the pain crisis anymore.
It is an immense relief for Hall and her family.
The fact that KJ is 8 years old, and so she knows that now there is a gene editing therapy out there. Just imagine what it's going to do for her mind and what she may do and what she may add to sickle cell.
I'm 78 and lived in Seattle most of my life.
For someone recently diagnosed with Alzheimer's disease, Andrea Gilbert remembers things remarkably well.
My dad was in the newspaper business. He was with the Associated Press. And then he eventually went to work for Boeing. So I kind of followed his lead, and I thought for sure I really wanted to be in the newspaper business.
Following her father's lead, she did when she returned to Seattle after attending college at Tulane.
And at that point, I started working immediately at the Seattle Times.
Gilbert started as a copy girl and eventually a cub reporter where she covered it all. And one year when the circus came to town, she got a ride on an elephant for a parade on 4th Avenue.
We rode all the way from the train station to the Seattle Center and back in the hot sun on these very unhappy elephants.
Memories that are still vivid for Gilbert. Memories that one day she may not remember because of her diagnosis.
I think it's almost embarrassing to tell people that you have it, because then they're going to think less of you than maybe you really are.
You went to UW Law, right?
Yeah.
After her reporting career, Gilbert turned to a career in law.
I went to the UW bookstore and bought 3 of these books for practicing the LSATs.
Yeah.
And actually did pretty well on the LSATs.
She got a full scholarship for UW Law School and later started a law firm and practiced divorce law until she was about 70 years old.
You really get to know people that are your clients.
As much as she remembers her past, Gilbert still recalls the day about a year ago when she knew something was wrong.
I was out in Kirkland. It was pitch black. It was like 11 o'clock at night or something. I was coming home from a friend's house. And I just got totally lost. Okay.
Several tests and MRIs later.
And then they discovered that it was Alzheimer's.
So Alzheimer's disease, as you know, is a progressive condition.
Dr. Thomas Grabowski is a neurologist and medical director of Harborview's Memory and Brain Wellness Center. He says Gilbert has mild cognitive impairment, an ideal candidate for UW Medicine's rollout of a new treatment called lecanemab to slow down the effects of Alzheimer's disease. Lecanemab is an antibody that binds to the proteins that cause plaque buildup in Alzheimer's patients and makes it easier for the body to remove that damaging buildup from the brain. Clinical trials have shown a 27% slowing of cognitive decline when taking the medication for 18 months.
I think what makes me optimistic about the medicine is that the data show both that there's an improvement in the clinical course and an impact on the biology of the disease.
Yeah, that should all work pretty automatically.
The results are positive but modest.
I tell my patients this is not a cure, this is medicine.
And you're going to do great.
Gilbert is among the first patients to receive the drug at Harborview, one of the first West Coast hospitals to give infusions for qualifying patients. Spreading word of the new treatment convinced her to open up about her journey.
I thought, geez, I don't really want to broadcast this as part of me. But I thought it over and I thought, well, maybe it's helpful for other people. So I said, yeah.
Andrea Gilbert will receive the new drug infusion for a year and a half. Remember, it is designed for patients with mild Alzheimer's disease. Those interested in lecanemab, that medication, can speak to their doctors for referral.
I actually had some pain in my chest that I didn't thought was maybe heartburn or something. Didn't think it was anything serious.
Sarah Marthosky, a 49-year-old Medford, Oregon mom of 3 and grandma to a baby boy, went to the ER when she found out it was something very serious.
And she said, well, you have tumors all over your lungs and your liver, and we don't know where they're coming from. And I was like, Oh, okay.
Follow-ups showed Sarah had colon cancer that spread to other organs. Doctors removed the tumor from her colon. She then started chemo to attack the cancer in her lungs and liver.
That didn't sound like a very long life, and I tried to want to, see if there's something more I could do. So that's when I explored other options.
Specifically for her liver cancer.
I was doing research and I found that histotripsy.
Histotripsy, a new non-invasive procedure offered at Swedish First Hill in Seattle designed to target liver cancer.
She has metastatic colorectal cancer.
Dr. Evan Ong is a surgical oncologist at Swedish with a focus on upper GI cancers. He's also trained to perform histotripsy on patients. This video provided by Providence Swedish gives us a glimpse of how it works.
It's ultrasound driven right now in the sense that you visualize the space that you want to treat by ultrasound.
Sonic pulses create a so-called bubble cloud that targets specific areas to basically liquefy tumors.
By controlling the bubble cloud in a specific area, you can actually utilize that to map out and treat areas that you want to destroy.
The device is FDA approved to treat liver cancers, and Sarah was an ideal candidate because she still has to be on chemo.
And so if you're on chemotherapy and you do surgery, sometimes we do it in an emergency, it's a known risk factor that you can have increased infections and complications during the surgery. Histotripsy is different because it's non-invasive. You really don't have to stop chemotherapy.
Sarah traveled to Seattle to get the procedure in March.
I wouldn't have known anything was done, so I felt good the whole time, which was amazing.
She and her medical team are now awaiting scan results, and they're staying hopeful.
She has a fairly good prognosis in spite of the fact that she has metastatic disease that's changed over the last decade.
Sarah says she is glad she found another treatment option for her liver and urges other patients to keep researching and not give up.
I've never asked for a timeline of what I have because I don't believe in that. It's all in God's will. So it'll be what it'll be. But we're marching forward and trying to find something to get rid of this.
73-year-old Floyd Gossett of Seattle has been fighting the battle of his life. 3 years ago, he was diagnosed with stage 4 prostate cancer.
I talked to my primary doctor. I said, I'm having some issues, but it's cleared up. And she said, well, let's take a test. Within 3 days, she said, you need to go see a urologist.
He was referred to Dr. Yao Niami, a urologic oncologist at Fred Hutch Cancer Center.
And I became quite calm at that point.
Calm?
Yes.
Why?
Because it was a black doctor, which I had not had before.
Gossett says he trusted Niami, who conducted a biopsy and confirmed the prostate cancer.
I think we need to start by recognizing that this is a structural and social issue.
Niami understood patients like Gossett face unique challenges when it comes to health care and points out Black men are 60% more likely to develop prostate cancer.
Black individuals in the United States have worse outcomes for a wide range of cancers and diseases, whether they be cardiovascular, kidney-related.
Niami is part of a Seattle-based organization called Backpack to figure out why that is. Backpack is short for Black and African Descent Collaborative for Prostate Cancer Action.
The idea really was to create a forum that would allow Black men and men of African descent to participate in prostate cancer research.
Men with average risk are generally recommended to begin screening for prostate cancer at age 55. But Niami says Black men are twice more likely to die of prostate cancer and are diagnosed about a decade earlier in life.
The average age among Black men seems to be in their 40s.
I know it's probably very complex, but in general, why do you think that is?
When we have inequities in healthcare, especially along racial constructs, it's important to recognize that race of itself is not a biologic construct. It really is a social construct.
Niami's research points to disparities in screening opportunities and overall healthcare access and resources.
Well, I felt that what happened to me was a disparity, definitely.
Gossett says a previous physician years ago indicated that he didn't need a test for prostate cancer. After experiencing symptoms, Gossett then asked his primary care doctor for a test and got it, leading to his diagnosis. But he wishes he found out sooner.
I don't want this to happen to anybody if I can get that word out so they don't find themselves at stage 4.
Gossett is still undergoing treatment, but now feels empowered with the knowledge he needs to fight it and urges other Black men who are younger than him to get screened.
being aware of this is the new message that's coming out.
I started having what felt like asthma attacks.
Alexis Harris is a professor of sociology at the University of Washington. In 2016, after getting her symptoms checked out, she was diagnosed with a rare blood cancer.
It was MDS. It was aggressive, life-threatening, 18 to 24 months to live.
As a mother of two, the news was devastating.
When you're faced with death, any time with your kids matters.
She immediately turned to treatment options. A search in a database for a bone marrow transplant showed no matches, not even with her twin brother. For Harris, whose father was Black and Filipino, and her mother, white, finding a match was a challenge.
We are so underrepresented on the bone marrow registry. Us being African American, Asian American, Native American, Latinx, and then if you have any intersections of those identities, we have a very, very low likelihood of finding matches, something like 20 to 30%.
Harris's doctor then suggested an alternative, a transplant using stem cells from cord blood.
It literally saved my life.
When a baby is born, the umbilical cord that connects baby to the mother's placenta is clamped, then cut. For cord blood donation, the blood is collected from the severed cord, then tested and cryogenically preserved to collect stem cells. Those cells are then used for treating more than 70 different conditions, such as blood disorders like leukemia.
It really does not impact the mom or baby at all.
Evan DeLay is a former labor and delivery nurse and works at BloodWorks Northwest, a nonprofit blood bank. DeLay donated her and her baby's cord blood when her baby was born this year. And for her, the decision to donate it was a no-brainer.
It's such a simple thing you can do to potentially save a life with something that you would otherwise dispose of as medical waste. So you're basically turning trash into a life-saving treatment.
DeLay says the donation is confidential. Harris knows she can't contact whoever donated their cord blood for her stem cell transplant, but she compares the donor mom and baby to a hero.
You know, what better a way to start the first day of your child's life by having them be a superhero and save somebody else's life.
Thanks for joining us today. To check out my most recent Healthlink report and get the latest health news, visit king5.com/healthlink.